Are you feeling overwhelmed by the complex world of Medicare and healthcare coverage? Don't worry, I've got you covered. In this video, I'll break down the top 9 essential tips for mastering Medicare and understanding healthcare coverage. By the end of the video, you'll feel confident navigating the ins and outs of your healthcare benefits. Let's dive in and take control of your healthcare coverage together.
This is Retire Ready, where we break down retirement planning and make it easy to understand so you can live your golden years to the fullest. Planning your retirement starts now with your host, Kyle Hammerschmidt.
So first things first, what exactly is Medicare? Medicare is a federal health insurance program primarily designed for people who are 65 or older. Medicare helps with the cost of healthcare, but it doesn't cover all medical expenses or the cost of most long-term care. For example, let's take 65-year-old Sarah. She goes to the hospital for a knee replacement. Medicare would help cover the cost of her hospital stay, surgery, and follow-up care, but she might still have some out-of-pocket expenses. It's important to understand that Medicare is different from Medicaid, which is a joint federal and state program that helps with medical costs for some people who are limited with income and resources. Next, I kind of want to walk you through the different parts of Medicare. Now, let's break down the different parts of Medicare. So there's 4 parts: A, B, C, and D. Part A covers inpatient hospital stays, care in a skilled nursing facility, and hospice care, and some home health care. For instance, if I take a 65-year-old who has a heart attack and needs to stay in the hospital for about a week, Part A would basically kick in and pay for much of that stay. Part B covers certain doctor services, outpatient care, medical supplies, and preemptive services. So if I have a 7-year-old Maria that sees a specialist for arthritis, that's where Part B would kind of come in to cover some of those costs and necessary visits and ongoing tests. Part C is really known as Medicare Advantage. It's an alternative to basically Medicare A and B, offered by private insurance companies and approved by Medicare. We'll dive into this deeper later today. And then Part D it adds prescription drug coverage. So if I have Bob needs medication for his high blood pressure, Part D would help cover the cost of those prescriptions. Going back through all this, just having a good understanding is very crucial for making informed decisions about healthcare coverage. Next, enrollment period. So knowing when to enroll in Medicare is crucial to avoid penalties. There are several enrollment periods to be aware of. First is the initial enrollment period is a 7-month period that starts 3 months before the month you turn 65. It includes your birthday month and then ends 3 months after. So for example, July 15th is your birthday. Your initial enrollment period begins April 1 to October 31st. Next, you have the general enrollment period, which runs from January 1 to March 31 of each year. This is for people who didn't sign up when they were first eligible. Next is the annual enrollment period from October 15 to December 7, allows you to change your Medicare coverage. For instance, you could switch from Medicare Advantage from Medicare to Medicare Advantage during this time. There's also a special enrollment period for certain situations, like if you're still working and you're covered by an employee insurance when you turn 65. So for example, let's say a 65-year-old is still working and has health insurance through their job. He or she can delay enrolling in Medicare without penalty, and she'll have a special enrollment period when she retires and then after she loses her group health coverage. Next, let's talk about the cost. So Medicare isn't free. Most people don't have to pay a premium for Part A if they or their spouse paid for Medicare taxes for a sufficient time while they were working. However, Part B has a standard monthly premium, which can be higher for high income earners. In 2024, that standard premium for Part B, $174.70 per month. Again, this could be higher depending on your income. Part C and D are offered by private insurance companies, so costs vary. For example, a Part D plan might have a monthly cost of like $60 per month for the premiums, and there could be copays for prescriptions. There are also deductibles and copayments and co-insurance to consider for all parts of Medicare. For example, let's just say Part A deductible for 2024 is $1,632 per benefit period. This is crucial to understand your budget. If I have a 68-year-old Tom, he has original Medicare A and B and a Part D plan, his monthly cost could look something like this. Part B, $174.70. Part D is $60. Monthly cost is $234.70. He'll need to budget for deductibles and co-payments throughout the year. So like Medigap plans, this is kind of where this would kick in next, is Medigap or Medicare supplement insurance is extra insurance you can buy from a private insurance company to help you pay for your share of cost in original Medicare. There are standardized Medigap plans labeled A through N, each offering a different level of coverage. For example, Plan G is popular because it covers most of your out-of-pocket expenses except Part B deductible. The best time to buy Medigap policies during your Medigap open enrollment period, which starts the month you turn 65, when you enroll in Part B, and can last for 6 months. So let's say a 65-year-old enrolls in Medicare, original Medicare, and decides to buy a Medigap Plan G. This might cost her an additional $200 per month. It would cover most of her out-of-pocket expenses to help you set up for that predictable healthcare expense like retirement plan. I want to talk about Medicare Advantage because this is what's called Part C. It's an alternative to original Medicare, and it's offered by private insurance companies and approved by Medicare. These plans must cover all services that original Medicare covers and may offer extra benefits like vision, hearing, and dental coverage. However, you may have to use doctors in the plan's network and follow the plan rules and how to get services. So an example for this would be, I have a 64-year-old David, lives in the area with several Medicare Advantage plans available. He chooses one that includes dental and vision coverage with a monthly premium of $25, okay, in addition to his Part B. David likes that he has a single plan covering all his needs, but he needs to make sure his preferred doctors are in the plan's network. Prescription drug coverage. This is a big one. So Part D adds prescription drug coverage to original Medicare. These plans are run by private insurance companies approved by Medicare. Each plan has its own list of covered drugs called a formula. It's important to check if your medications are covered before choosing the right plan for you. For instance, 66-year-old Linda takes medication for diabetes and high cholesterol. When choosing a Part D plan, she compares several options to find the one that covers all of her medications at the lowest cost. Now I want to talk about high income earners and what you pay for Medicare. If your income is above certain thresholds, you'll pay more for Part D and D. These include related monthly adjustment amounts called IRMA, and they're basically looking back to every 2 years at your adjusted gross income. So for 2024, single filer, in 2022, if you're over $103,000 and married if you're over $206,000, you'll pay a premium ranging from $244 up to $594 per month. And just understand that standard premiums at $174.70 per month. Part D also, the IRMA rules apply, where you could pay an extra $12.90 up to an extra $81 per month, depending on your income in 2022. So remember, every 2 years back, adjusted gross income. You can appeal IRMA, Part B and D. So again, IRMA is that income-related monthly adjustment amount. If your income is above a certain level, you will pay more for Parts B and D, as I mentioned. You can appeal if you've had a life-changing event like retirement or reduced work hours, marriage, divorce, or even the death of a spouse or loss of income-producing property. Here's how to appeal. Get Form SSA-44, download it from the Social Security website, fill it out, provide details about your life-changing event. Now you need to gather some documentation to support that, like proof of tax returns and employer letters and legal documents. Then you're going to want to take this completed document and then submit it to your local Social Security office. You can mail it or drop it off in person, and then follow up with Social Security to ensure they've received your appeal. If approved, your IRMA could be reduced retroactively. It's important to remember, don't let IRMA drain your wallet. Appeal today and potentially save hundreds. Working past 65, pretty popular. So if you're still working at 65, you might be able to delay enrolling in Medicare without penalty if you have qualifying health coverage through your employer. So for example, I take a 65-year-old Mark still working full-time and has health insurance through his employer. His company has more than 20 employees, so his employer coverage is considered credible. Mark can choose to delay Medicare enrollment without penalty. However, he should check with his benefits administrator to understand how his current insurance works with Medicare. It's also crucial just to understand how your employer's coverage works with Medicare to avoid gaps in coverage or unnecessary costs. If you thought this episode was helpful, like and follow for more retirement planning and Medicare money saving tips.
You've been listening to Retire Ready with Kyle Hammerschmidt. Planning your retirement starts now. We hope you've enjoyed the show. If you did, make sure to like, rate, and review. We'll be back soon.